thank you for everything. We make all this prayer to Christ our Lord.
Amen.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. I'm Famble, as I say, welcome again to the Wel Bodi Tok program with me, Gifty Masakoi. And with me now also today, again, my special guest, we na nos Alimatu Maria Dean Gabisi. Alima, I can tell Famble they are doing.
Family, good afternoon and Merry Christmas to all.
Merry Christmas to all. Today, the Christmas fall on Sunday. We don't go church and come. We don't come again for help famble them for no but well body business. Time done between 10 minutes late. We get some technical things that will be they put in place, but we don't come on air. Today they talk about topic with the Hamburg woman them. And that topic we talk about today, we the name high blood pressure inside belly. High blood pressure inside belly, where the medical people then can say pregnancy induced hypertension. Other way we don't experience some belly, or would presently get belly the experiencer in know exactly waiting they can talk about, or you we don't take care of that belly woman day, you the well body workman, we don't take care of that belly woman day. Either if he gets this high blood pressure before he get belly, or now where he get the belly, now day he gets the high blood pressure. We go know more bodies so that you go able for help. Famble them where we do it, or you when a man go able for help you with, or you when the belly woman says if you go know waiting you for do or waiting you not for do. So Alima, Merry Christmas again.
Happy thanks.
So today we talk about high blood pressure inside belly. High blood pressure in pregnancy, we will call pregnancy induced hypertension. People go on know a little bit more about that.
Well, high blood pressure inside belly, we then can also call pregnancy induced hypertension. Now hypertension where belly woman they get, where we say it not be get pressure before, it not be get hypertension before, but now the belly make it get the hypertension, and normally it can occur after 20 weeks. When the patient don't in belly don't reach like 20 weeks, we like not 5 months, after 5 months or after 5 months. Now this condition can set in.
This condition can set in. So high blood pressure inside belly, where woman get belly, it's possible for like get high blood pressure. And when this commonly they happen, now around 5 months where you get the belly, where well body workman go see inside 20 weeks. What can cause this high blood pressure from belly woman there?
Well, according to Master Sabi people, they're not able to know right now waiting at the right cause where they make this condition happen. But however, we get certain things there we go predispose you, we go make you dey at risk for get this condition here where you dey belly. Okay. And some of them risk factors they are: number one, obesity. Also obesity, like you too much fat, you put on too much weight, you're able to control your weight even before you get the belly or where you dey the belly. Then also previous hypertension. If you don't get high blood pressure before, even before you get belly, if you don't get high blood pressure, you dey at risk also for develop this condition. Also again, if you get diabetes, you dey at risk also. So now some of the things in this way they make you dey at risk for get this kind of condition where you dey belly, especially with the belly don't dey 20 weeks and 5 months or after that.
So now some of the reason then this we go make the woman get her. And as I say earlier on at the beginning of the program, it can be say the woman we don't get high blood pressure before the belly, a possible inside the belly let that pressure they continue, or and not we get high blood pressure before but the belly can make it get high blood pressure. So how the woman go know say now this don't happen? Waiting are the signs and symptoms we go able make you know say something they go wrong with me.
Well, there are key signs and symptoms them we go able to make you know say now this condition now you don't get. First of all, where you they go now hospital or where you doctor or your midwife they go see you, if they ask you first how old the belle. That na one. Then the signs and symptoms are now where you go dey observe. You go observe say you dey put on weight more than your normal weight. You weight dey pass your normal weight wey you be don dey get. Then also you dey get persistent headache. Your head go dey act that even when you try for take medicine for let it cold, e no dey cold. Then you dey get belly ache, but na upside, you right part of the belly, na there you dey feel pain. Then also you no dey able for wet. You no dey able for pass enough wet wey you dey go for go wet. So now some of the signs and symptoms. You know dey able for see fine. You dey feel like your eye dey dim, or you no dey able to see fine. So now some of the signs and symptoms then down dey.
Now some of the signs and symptoms down dey. More dey. And remember say e possible say for that you get high blood pressure, you no get none of the information there so wey Alima don give, because they always dey tell you say high blood pressure na silent killer. So you can get how you dey pass up and down. Somebody not even know. But if you give you message, now either you they say you eye the dark, or they see small thing then, or you hear the heart, or you they feel tired, and the other reasons them way you don't give. But remember say at times you know they get no symptoms. Then some person that in foot they go this way. So the swell and do for a way free for an away they wear it don't tighter. Okay, so with all of these, we can still get people away they at risk. You don't talk already about some of them. The one them we don't already get this high blood before belly, or now this belly make. Waiting are some of the other reasons the other than can they at risk where they no say if they get a belly tendency day or possibility day for me then get high blood pressure.
Also on that age, when you not reach the age for born pikin, you dey at the risk. Then also when you don't pass 35, you dey at risk for develop this condition. Then if you don't get belle before you get this condition be setting when you get you belle, you dey at risk back. Then if na twin pregnancy, like if belle where you get, you don't go do test or you don't go do scan, doctor tell you say this belle na twin belle you get to. And they make you at risk for this condition.
Okay, so all land they make you at risk. And I think while I was working at back now, the low socioeconomic status, of course, because most of the time women and they get too much stress, they remember waiting for it, outside for lay it, so all land they can add. So poverty self gets in your role for play with the add to stress, and at the end of the day some person they depressed, at the end of the day they sleep better, at the end of the day they think boku, so all that can contribute. We get Dr. Baylor we can always there between our studio today in our day in physical, but however he send a voice note, so let we listen to her.
hypertension. That I tell you, Indira don't ever take Indira will get hypertension in pregnancy. So if anybody you get they give Indira, they say because you get hypertension and pregnancy induced hypertension, or even if you don't go to pregnancy induced, chronic hypertensive person, then you don't get belly. They give Indira, don't take her. That will come to problem. Then you can take labetalol, you can take hypertension, you can take the CDP. The CDP, the steroid release, like you normally give the CDP, that are Adalat. Those are the drugs. But the most common one are the time data. Magnetic. No, not magnetic. Magnetic are diuretics. Yeah, we can do that.
So, fumble them. Sorry, I think say because we dey get challenge for the one them way they on Facebook, radio we dey get them, but we dey get some challenge. We get a bit of the presentation again by Dr. Baylor.
Then we get labetalol. These drugs we use in pregnancy. Please, for the pre-eclampsia, normally pre-eclampsia, anything we do by this self-fix. They always all at the hospital. But if you do eclampsia, during pregnancy, hypertension, say one of the complications of hypertension is normally you send them to say 10% of they get belly, we call it pregnancy in English, we get belly, 10% they come down with hypertension, then the blood pressure will increase. If they increase, most times we call it pregnancy induced hypertension. So one day, some people do from any program, they never get hypertension, but as they get belly, they get hypertension. The pressure, the blood pressure will increase above the number. We will normally class and see the WHO 140 is systolic, 140 and above. Then the diastolic 90 and above. If you get that sugar day, then you are hypertensive. And most women, 10% as I also in single sugar, they get better than they get hypertension. But before I come to the drug, let me talk briefly about the complication of hypertension. One of the complications related to eclampsia, pre-eclampsia and eclampsia. Pre-there are seizure. You know, the part where the time you get seizure. So only you get abortion. That is, the placenta they move away from the walls of the cervix. So it will lead to like abortion, or premature delivery. And most times also the other complication is that doctors will be forced to let them do induce labor before even term. Yes. Before the belly is strong, because if the hypertension don't work, for it has saved the life of the body, they just go for induced labor. Either they do the labor prematurely or they terminate that pregnancy. Those are the complications. And the treatment basically allowed them the drug of choice for pregnancy-induced hypertension or any woman with hypertension. The drug of choice mostly commonly with the use of the thiobuta. Thiobuta that we call that the drug of choice now. Then also, but in pregnancy generally, we can get other drugs that hypertensive drugs that we will do. We get the hypertension, where they give the hypertension, that one of the drugs that for drop down in depression, so high for drop down fast. But now they hospital, they will give them what they do. That specialized drugs for hypertension. Then we get also the labetalol. Labetalol is a beta blocker. But we will use labetalol as a beta blocker. But I will say there is one beta blocker is contraindicated in pregnancy in hypertension. That are atenolol, we call Indira. Individual don't ever take individual will get hypertension in pregnancy. So if anybody you go, you get belle, they give you individual. They say because you get hypertension, pregnancy induced hypertension, or even if you don't get a pregnancy induced, you know, chronic hypertensive person, then you don't can't get belle. They give you individual, not take that you go to law. Then you can take labetalol, you can take hydroxyl, you can take the CDP, the slow release that you normally give the CDP that are Adalat. Those are the drugs. But the most common one are the Tylopa, I think magnetic. No, not magnetic. Magnetic and diuretics. Yeah, we can give them what they do. But the 3 key drugs or 4 key drugs, the one you get the Tylopa, in fact, most of the facilities they get. Then you get hydroxyl at hospital level. Then you get the CDP, for slow release, Adalat. Then you get labetalol. Those are the drugs we use in pregnancy. Please, for the pre-eclampsia, normally pre-eclampsia, we do magnesium sulfate. They always all at the hospital. But if you pre-eclampsia, pregnancy, hypertension, you know, say one of the complications of hypertension in pregnancy is eclampsia, either pre or eclampsia. Then one of you can do magnesium sulfate, that will be almost everywhere. So please, when you get belle, always one of the advice is always let everybody check the pressure. And one of the signs of for sure say you should always check your pressure. If you get belle, you will always become bloated, that you will be fat, then sometimes you will inhibitor. That you sit at the swell, inside it all, you will feel like pain within the belly. Always pain at the right hand, pain around the pregnancy, in the stomach. There are signs that you will put on weight heavily. Always try to check continuously, routinely with a check the pressure. So that if at all the pregnancy this hypertension can be, then we will handle it as early as possible. Yeah. So that are the basic I would say so far that we basic. I don't know that this is good today, but this is the basic information I would say. Let me give it too long. Thank you.
So that's not the voice of Dr. Samuel Bello. We always can dey at the studios, but because of duties in not na tongue, he don't send that message. Alima, what do you make up of waiting doctor say?
Well, doctor don't analyze the medicine then, way for take, and the one way you not for take, where you dey belle. You don't analyze the medications the way you for take, and waiting you for do. Then waiting the signs and symptoms and the major signs and symptoms where you for observe, where they raise alarm say, hey, this condition I want begin get to a better lab or hospital. So now some of the things then the doctor don't talk.
So now some of the things and then the Dr. Bello don't talk. We don't back up, he don't give you the statistics. And we know say every condition gets in statistics. Some statistics very small, but even though it's small, in results not can be good because it costs somebody in life. And remember say when the woman get belle, not to in normal, na in and the pikin. And some belle na twin belle. So meaning not to in one and na in and the pikin them. So you get for look after the woman in yon and the pikin them. So woman where they with high blood pressure inside belle from 20 weeks upward, you get for come for monitoring and all look each that side. But just for fumble the way just they join we wanna know say today we they talk about high blood pressure inside belle. Where woman get belle, the in pressure high. Normally the pressure for fine where it get belle. Although as physiologically as the body they work, the pressure can low for certain time. As it they go in normal, say it burn back, it go. But in some instances again, so woman either it be get pressure before the belle, and where the belle dey, the pressure they continue, or some not be get pressure, but where it don't get belle now, this belle don't make now it gets pressure. I mean call them pregnancy induced hypertension. So Now make them can call am back say either gestational induced hypertension, because now that belle make as e born that pikin, so some woman as e born the pikin in pressure dey normal back, whereas others after e born that pikin they continue still for the monitor the pressure, e get tendency for there e continue with high blood pressure, just like how we talk the last time about diabetes in pregnancy. Remember say as we start some causes them they don't tell we say e unknown why make it can happen, e unknown, but another one can be either something e get kidney problem, or as Alima don't say sometimes because of the twin belle, or if you don't get previous history, so all land the tendency dey for a recall. And the pressure normally, as doctor say, for the 140 all over 90. So anything above any of them two number, then they na concern. The 140 when at the first reading, when at the pan-tap number, then call on the systolic, then away the heart they work. Then the bottom one waking they all over. The example 140 all over 90, the bottom one you see say in always lesser than the first one, meaning where the heart they at rest. So mostly we they consider that bottom result where the heart they at rest in number not for so high. So where you see begin high na concern. Yeah. So Alima, doctor don't explain more. I don't even go on to the pre-eclampsia and eclampsia. You get anything for Rob Mott Panda one day?
Yeah, I guess small thing for Rob. Pre-eclampsia, like na the mild one, you know, it's that severe one yet, but it don't raise alarm. But as soon as you reach eclampsia, na the bad sign now, because that don't tell you, so you don't send signal to you say damage don't occur na the brain. And now there you go see now the belly woman go begin get seizure. Or say seizure, pancreas, you go see the belly woman they get fit. We don't know that they say this snap na devil they don't get. Not so devil now because of eclampsia, because it don't reach now the severe stage now.
The brain
now they that because the brain don't get damaged and
like
the brain
MPA.
is
Like MPA go power just now.
Exactly. So now like that.
Okay, so we know once let woman we get pressure reach that level where they begin for wet, the wet then test them, it get protein then or it begin can the foot swell, or it reach to that extreme level where it begin get that seizure, where it begin the fat person. So when I put spoon in mouth, when I make and so not to double the ibaya na the pressure because it don't pass how it for pass. Yeah. So Alima, how normally this condition, this high blood pressure inside belly, how normally it can be diagnosed?
Well, the diagnosis also say how they able for discover waiting how doctor they able for noticing that this condition this patient don't get. One, you they do physical examination wherein you the medical person you they assess the patient as you get key signs and symptoms where you for watch for. When you can do assessment, ask the patient how old the belly na one. Then you monitor in blood pressure. Then even the blood pressure, you not go just monitor once, then you confirm. If you monitor like 2 to 3 times, then forget 4 to 6 hours interval or 6 to 8 hours interval. Then as doctor we don't say this is totally not for the above 140 millimeter mercury where the at the at work. Then the diastolic not for the above 90 millimeter mercury at the at rest. If it is above that, now it call for concern. Then also you go do wet test for see if protein there now the wet. Then we'll do kidney functioning test for see how the kidney they work. So now some of the testing and the way they do for diagnosis condition, sister.
Now some of the tests then that one day where then they do, but one key one at that time where the nurse or the doctor they tie the hand for there waiting na the pressure. We now want pay attention more to the pharmacological value. Dr. Baylor already talked about them because now one day mostly you get the one way now hospital normal or get for administer because of in high observation where you need like the hydralazine we call apresoline where can suddenly drop the pressure, and no need for let it take away from the hospital. Whereas you get the one wey dem can give am when I take home drug, you get the other level where if you don't go far, where you don't begin to go into that seizure, you also need for the hospital where then get timing where then they give am that injection where then call the max off. But we know they wish for let you reach that side, because when don't they reach that side, then go get for decide whether for do the operation one time or for see waiting and go do the doctor for see waiting for do for let that woman day in life and the pikin or the pikin then your own life come out inside. Yes, Alima, we don't look at waiting at this thing, this pregnancy induced hypertension, when a gestation at hypertension, or when a high blood pressure where woman get belle. We same way so don't talk say some people, so woman can already get the high blood pressure before belle, whether one can consider for be chronic hypertension, whereas others now during the belle inside 20 weeks then they detect that one day for say they don't get high blood pressure. You don't name some of the signs them where the woman goes or the complaint the way you go get there. You don't give risk. I think say obesity, this big body, a cut across from boku conditions them. So do ya before ever we they go to advice. All woman them, let we try for watch, we wait. Then they not go they tell them say body don't find your body, but within yourself you really know say that kind of body where you don't get, you know, okay. Health wise, you go get forget the challenges or the consequences. Try for work on them. If na medicine they take we make it they get that kind of body or whatever, try for cut down on them, because so many challenges they with obesity. We forget another audio. So we move ahead. Alima, you know nurse. And we don't see then cases there. Just now you talk say at times where the patient there they get a convulsion or fit. People can the lay person they say na their body they see, or you get something for talk, or na spiritual something. But when the medic come then do them basics, they know waiting at the problem. Then when you see them give the required or the prescribed medicine, straight off the devil they left the woman or they get into difference straight off. So now we need for look at 3 factors. One, for listeners and viewers them, either they will get community people or they get them family members them we pregnant now. For me we look at 3 factors waiting na the role of the woman where he gets belly.
Well, the role of the woman where you get belle, number 1, you forget at the back of your mind say na 2 life you dey play with, you life and you picking in life. Then of course if na twin belle, either 2 or 3 life now you dey play with, or 4 life self. So you forget at the back of your mind. First thing what you for do, always make sure say you attend antenatal clinic. Antenatal clinic mean that clinic where you dey attend, where you dey pan belle. Make sure say you go for your regular medical checkup. Make sure say you dey monitor your blood pressure. Even if you no get blood pressure machine na us, because say you go say because you no able to afford that or so. But at least if you get nurse na the area, or you get person when a medical somebody, you can talk to them. Do you beg I want you go dey monitor my pressure for me, even though I get for go hospital so time, but I need for they know me pressure. So in case of anything, I go able for raise alarm. Then also you need for the watch you weight. Some certain way then they are your body be done day. You see say you not that fat. Even if you're not that fat possible, you for the watch you weight, try for maintain your weight. Then after you go the antenatal clinic, it not necessarily mean say pass you the same way you booking date where you midwife or your doctor waiting for you now for go. If you see, you observe any sign and symptom, or you observe any way where you dey feel where you not okay with, now your responsibility for let you report as early as possible. For let all that you know go happen where we no go like.
For let anything no go happen where we no go like. So belle woman, where you get belle, you get for go school, and that school day na the antenatal clinic, meaning anti means before you born. If I go that clinic day, so it depends how the belle day. They go give appointments every month. There's the time they're going to go tell you say every 2 weeks. As them they're going to go say every week. But if you get special conditions, on them go tell you say every week or every 2 weeks, as then see your condition. So belle woman, na for go clinic. Na for go na clinic. Belle woman na for go na clinic. Usai midwife day, usai the doctor the day we go watch you, and then they give you book where they don't take you information. Ask the nurse where they look after you, because on them go say the nurse, the patient emboku. Ask them if you get any key thing where na concern, and anything where they tell you say na concern, take and serious and work towards that. Go na clinic with your antenatal card, and if they don't take note say you get high blood pressure, get a small book. As Alima don't say, anybody near you get blood pressure machine, try for check am. But one key message or one left give una, or one for encourage una, do ya. I not say we all not to medical people them, but the world they advance that even some person in watch way either way, where is set out with in phone, it they tell her in pressure. In watch way either way, where is set out with in phone, it they tell her how many hours is sleep and all of this. So try for secure one blood pressure machine when electronics. Then go teach you how for use them. And if you see say you they take and the pressure high, then you know say you get the need for go see doctor. Do ya, you know, in you will get fambul oversee or we get post where they help you. The best gift we go tell a leg you we get belly say, do ya, let's send for you blood pressure machine. A very, very important, and get your own book and get your own pen. And you self we not get belly, blood pressure machine very important for you. Whether you want to use your phone watch, the watch where they walking live with your phone, or they send them for you the electronic one. So it will be a guide for you, because where you go now, if not anything where you look worried about, then go able to use the manual machine where then go able for recheck again. So that's now one thing. And respect the follow-up date where they give you. But if anything happen before that date they wait and give you, not wait, stay, say, then be tell me say in the next 2 weeks. If you come out except today, now today you feel problem, you know, okay, now for go back. Yeah. Then try forget you nurse or the post where they care for you a number. Then can take una your number. Una say try forget a number. So certain things them una go need for ask them. Then you will get this high blood, then go get for tell you certain thing them. But you eat one, you reduction in oily food, you reduction in salty foods, then go tell you all that one day. And you will go see you see that your foot don't begin to swell, then go give you all the advice. Then you not get for forget for the exercise small. Then if they put you on medicine, as doctor say, the medicine way they no say if you go na host you go they able for take now for take the medicine, but yet go they check the pressure, because there are times that the pressure not go down too much, then you still they take you need for the check you pressure. Well, that's not the one for the patients them. Also advice you think say we go give to the support persons?
Well, to the support person, be the husband, the family members or other relatives, now na responsibility for say that belle woman, they with that belle safe. Say to the time where God they deliver them, nothing not happen to him and the baby. Always encourage the belle woman for the go clinic. Encourage her for the monitoring blood pressure. Encourage her for the exercise. At times you see where the belle woman they go antenatal clinic, you tell say on grab and sing dance. So not they go and because they want to sing and dance, so but they want to exercise, because instead of get a role where they play. Then this is a special one to the spouse and the spouse or the husband them. Where woman get belle, not so that same day you for stress, and because again stress they lead to that. Not so that tell you for stress and give something or begin to eat and one kind way where it they put na in mind, then say they all they lead so that we go make the pressure shoot up. I think say where woman get belle for you na the best thing and the way you need for encourage and give the love and caring way in need. Pamper am. If possible, self accompany her na the antenatal clinic. If you ready for go today, as long as you not busy or even if you dey work, find time when you less busy, watch in appointment time. They say today, darling, I dey go to you, make her go see how they take care of you. with that you dey raise the woman in courage, you dey help am for let e go into safe delivery. And as we say, we no want for the you say woman die pambele because of so or we lost pikin. Not a good signal at all.
Not a good signal at all. No belle woman not for die. When he go for born, he not for die.
And the pikin also.
The pikin also not for die, because now then they take after we. So belle woman, now the message down there, and you when are the support person, whether you na the man you dey near the wife, or you na the wife the man don't send you, or you and the man don't agree say you dey go born other side. Member say we don't say after 20 weeks, mostly in that one day can be evident. So if you don't left, you also say you dey go to your mother or you dey go to your mama and any other side where you feel say na unsafe na day you want go born. Not forget your health, not forget your card, and always see if they go able for go with you na hospital, make them safe go learn and know waiting na the thing. Then we go now to the Wel Bodi Workman. Whose message you get for the Wel Bodi Workman? Because boku belle woman no know. So you just they go in hospital no more say then check me. There's at times some go say they not even tell me how the pikin they safe. Na me tell them say this, na me tell them say that. So whose key message we go send to the Wel Bodi Workman there?
So with the Wel Bodi Workman, then the message for now that's now we responsibility. Now we responsibility for explain to the patient whatever we want for do to her. Enlighten the patient, make sure say you know waiting and waiting you they do for her. Then after you don't do waiting you for do for her, you don't give you care where you forget to them, explain to them. So instead of able for understand and know how for manage in condition even when you no go day, or take the time when they rush her for Kamna hospital.
Wel Bodi Workman them, na the word that with duty na communication. For learn for communicate, you for be a good listener, talk less and listen more. But if the patient go to hospital now, you dey talk. At the end of the day, the patient go just say, well, this it look no all till I forget. So allow him for talk. Also, you get out, you ask him questions, because we not say one reason for let people get high blood pressure, and especially in belle, as Alima don't say, it can be stress. Sometimes the man they talk to herself up and the belle in the woman first gain your attitude. They don't gain suit everybody for see man self you know and see again and all because of physiological changes where they take place. So all of them thing they are so can waiting. So the nurse's role or the healthcare worker in role, you wait in a lab, they get for go meet you for do lab tests, get for do blood tests, get for do urine tests. You waiting at the ultrasound side, get for go do that test. Sometimes a boy picking once, then go do the ultrasound, saying a girl picking. So that's can be one stress. So by you listening and talking to them, you they able for pick up waiting at the problem, because I can always say no two people are the same. No compare this and this. Sometimes again you reason why make a guy blood pressure. The other one again you reason. So when you ask them, you go know and you go know who say you for tackle. Whether na man business or make the pressure don't go high, or whether na the physiological changes na the body, or whether as the belly they progress they get some pressure, especially for primigabidas, the one they them first time for get belly na the first speaking. So like then they look at, they don't watch boku film, they don't get boku experiences there, they don't listen from different people. All man they talk, so they begin they think now maybe na network all man they sleep now you time for begin one day, how I go get for do this, I go turn like this now operation, or I go born for myself, or I no go born. So all that they play now in one great mind. So now it make we get for pay attention to them, we get for be a good listener. And the other one, when they can the antenatal, especially that first one, that booking, it get for take a lot of time. So you the belle woman, where then they can meet you, do ya be open up. We not say one of the key thing where Wel Bodi Workman for promote na focus antenatal care, that 1-to-1. I make now they say na contact, now not to visit. The way they can na contact you, they get with the Wel Bodi Workman. Get for ask you so many questions, your family history, your social history, so many history. From that history, it is able for guide for me then no say na this or na this, because don't see one is where they cause high blood pressure back in belle woman and back low socioeconomic status. If the woman get belle this morning for nothing or they for it, or telling it for the one for what the man they say they care, or they don't tell and say for go do so test, but this particular painkiller one all day, you get for go pay for. I begin to think about something another person get for go sell person 5,000 market in the morning. Then they don't say get for pay 80,000 for something. So they first now other stress panel. So all of this added, the Well Bodi workman, they need for pay attention, they need for listen more, they need for encourage them, they need for be positive to them. They need for take note of the key informations them and see how they go able for help them out. Then also for let them go give prompt treatment, especially when they don't pick up saying that this na the issues, for pick them up. And also for explain to them say, well, you don't get this high blood pressure. It possible say it go control. So you get for control the what you they eat, especially the salt. You get for control, you get for the exercise small, you get for the watch your food stay not they swell, because if you not control them, it go lead to preeclampsia. And when you go lead to down the back, either yes. If you go back more and more according to the test them, then they differentiate them by how the food swell, by how the protein they inside the wet. All of that, and then where it was now, we begin get that fit. So if that woman dey pambele, they not try for help and for me it born, na problem for let it go lost the pikin, because challenge day to even the woman and challenge day to the pikin. So do your family members or support persons, don't not forget for give them with psychological support. Then you the belle woman, not forget for meet you appointment date where they give you na hospital, then tell you any test for do try for do one. Try for get you blood pressure machine, and remember say blood pressure na key. I mean, they call them vital sign, important sign. Without medicine, that machine no more than they tie na you hand, they give signal. Now make what you go get for rest first. You go then test that once and say they up. Just rest your mind and go get for check out over 3 times. If they say not the same, then go still give you appointment when again for hours. Alima say some hospital go say well admit them because we need for the monitor in the next few hours. Then if they arrive at anything plus your history, they know the correct treatment where they go put you on. Because we want let you born the pikin live one and let you save come out inside. Yes, Alima. Whose message you want left with family them, especially for this belle woman them where they get high blood pressure, and as we they walk towards no belle woman and no pikin no for die where the belle woman go for go born.
First to the belle woman them, always make sure say you go antenatal clinic. Lifestyle management, try for manage stress, watch your diet, always control your weight. Then complain any see where you observe or any sign where you observe where you see so you know okay with. Complain as early as possible. Not say I go wait say na next week me not say lab, me midwife say lab, or na next week me doctor say lab. The moment you begin observe signs or symptoms, you begin observe where you know okay with. Complain as soon as possible. Then also one key thing, blood pressure machine. Some of we are able for afford that, because if you're able for buy Bamako for well, you're able for provide, sacrifice that blood pressure machine 3, 4 or 500,000. You get able to get her where you go talk to your nurse, let it teach you. Even if so you go reach to them that even if you not get possible for check out for you say, but if you don't teach you say where it is so and so reading. Now cause for alarm where they to this side, it okay. You see say able for monitor your blood pressure machine. Then so you see say able for blood monitor your blood pressure na us, even if medical person no dey near you. Then so other relatives, be it the husband, the spouse, or the family members, I feel say where woman dey babele, and the best thing that they wanna forget is the support we in need. Get the support we in need now. Make sure say una monitor and see say they take in medicine way doctor or in midwife mark, if they go clinic to the correct time. Then if you not feel any kind way una okay with, una send na hospital as soon as possible. I mean advise them
as soon as possible. And I can like some granny them and some neighbor them and can so inquisitive in the positive way. Say, but you food is swell, why you look quiet so you be this so you get for be very, very observant. And it can be hard to for the man and the woman then at the same house and they sleep in the same room. The man not even know waiting they go on with the woman.
Sister, not cut you. You know, say at times where the woman go say tomorrow I go for go clinic, I go need so and so maybe I need for pay transport or I need for go do test. Someone can complain no. Somebody say, but who's kind money business or who's kind thing this? Yeah, the man then, the spouse, and they are going to support the woman, they ready pambele.
Yeah, una support the woman them where they pambele, where then they go clinic, una give them transport. Although we know say the woman themselves get role for tell the man, some man need for letting inform 1 or 2 months, 2 weeks ahead. So I get for go clinical, So begin to announce the clinic one day. So
let's on sing.
So I get for they go clinical. So if they tell her money is up na WhatsApp or text message, I get for go clinical. Or when they give you job money, you keep your transport because you know say you get for go. Remember say now you life, even though we want let the mama and begin their life come out, but if anything happen 10 chances to 1 now you life the loss. And it not go find now you family side or also you yourself where you don't go great beyond you regret and say not to be me them this for go. So dear, we don't listen, we don't follow this program. Let we be pioneers them for share them, for educate others, for say woman where you get belly and no matter the age, it possible say from 20 weeks when 5 months inside that belly for let the woman get high blood pressure. And if you get a high blood pressure and not controller with the medicine that we then go put her on, or if they fail for going to clinic, when at the antenatal clinic, we then go do that in screening for when they tie that, or if they go safe na clinic, you see say today the nurse say the machine on work or this that so you for try for ensure say let they always they check that you pressure. You know go always they not check the pressure, then you rely on that day. Try for get you book and pen and take note of some things then. If like inside the month where they don't you say the next 1 month, then you observe say 1 week you ate at almost o'clock it be at. Take note of an eye be at. So if you begin repeat again, then you gonna say, this belly inside so don't ask me so you know say that although it gets so many reasons them, but pambele you for not say that self it get reason. Per high blood pressure, it get reason per malaria, so many other things then. So you go take note of that one day. So not forget whether you get high blood pressure, you not get high blood pressure, where you dey cook, reduce the salt per you eat. Observe your food if it is swell. Oil per mind. Try for exercise. Let for sit down no more and play she send cow this for me, cow this for me.
The rest avoid
stress. Avoid this problem here. They're not singing their music.
They kill person.
Problem they kill person. Problem they done. So just do what you able for do and go off the stage. Let the other person get your belly. So just do what you able do. So if at all you know able manage this stress, however it be stress calm because stress can kind of positive on next. Some man can get belly, sometimes exams day or so many other things. And a positive stress. We hope say you go sail through your colleagues the way they study with you and all, we able to give you the support. Likewise, the negative stress we go tell on you or tell on the pikin do with the big support persons there. Now no they add salt to injury we go cause more problem for give the woman more problem when it can in one day I can say where 2 people sleep when morning can let nobody not say they sleep fine. Ask the next person let tell you in sleep because sometimes not one wake you that net you know now in one go know wait till you go through. So high blood pressure very serious. Either the woman be get am before belly it continue inside belly or na pan the belly it get am. And if at all it not take proper care it go hamburger for belly, either the pikin go die inside the belly or it go continue for let the pressure go up or cardiac failure. All of these, even the pikin self, it go make the pikin self not they grow fine na the mama in belly because we too can call the afterbirth na the pikin they survive na belly they get placenta insufficiency. All this or it can even make the pikin get them prematurely deliver. Then also it can get problem pani mama when I syndrome we mean say get collections of other things then we call her the help. It get hemolysis where they get destruction of the red blood cells. It get elevated the liver enzymes and the liver where I can say mostly me can say na the steering pan the motocar na the steering pan the body na in one, kidney na two, but liver na in one. So like instead get enzymes and so with this thing, if you continue for more than the summer waiting they happen, their enzymes they are elevated, then the platelets them pan the blood safe they low and it very very serious. So do ya let we give support. If you do on the high blood pressure medicine and for take her, if you see say things they going okay with go one thing at the Wel Bodi workplace, listen to waiting and they tell you the health talk them. Some man can balance the health talk where they go na clinic. Say I want go miss they don't talk or I go no more let them see me. That health talk where then they give to the belly woman they're very important. You never can tell maybe for that day that health talk now for you it go. So let we go. Take care of you antenatal card. Let it easily reachable, let it some side. Then try for get your machine for the monitor. Remember, say high blood pressure now, not the thing about age, just like how we dey talk about diabetes. It can be said that you first born from age 20, say they go, it can block people them. So another one day. So Alima, you can send Christmas message to viewers and listeners then. And Miss F, thank you for coming today.
Merry Christmas once more to all viewers and listeners. Then a prosperous New Year in advance to now.
A prosperous New Year in advance to una all. Members say me na gifty Masakoi where they bring the program come to you every Sunday 4 to 5 Santem Wel Bodi Tok na Radio Maria Salon. Today we talk about high blood pressure in pregnancy. Where woman gets high blood pressure pambele. Same way so we can call them pregnancy induced hypertension. And my special guest today na nurse Alimatu Maria Din Gabisi, when a product of Redeemer School of Nursing and same way so Jala University. So Eden I today for share in ideas with people them, and we also want to tell Dr. Samuel Bello even in the absence is send in voice notes, and myself will be for send in voice notes midwife we will not able forget them. I also want for let we all thank God for this Christmas. Tell God thank you wherever you did for this Christmas because you get life, you able for see them. And let we hope and pray say in light will continue for shine pawi now this Christmas and throughout, and we all deserve for celebrate this Christmas. We want for tell una boku thank you, and we hope for see next week Sunday by God in power when at the beginning of 2023. But remember say high blood pressure pambele area, but you can give you support to Belle Woman Wel Bodi Workman, you can give support the support person, you can give support. Thanks to Seal, thanks to Joseph and all the one day where they make this program come live to now. We left for now in the name of the Father and of the Son and of the Holy Spirit. Amen.